Welcome to everyone to these Tuesday morning Toolbox Talks. To get started, we just obviously want to remind everyone about the prevention methods for COVID-19. Those are those 6 things that we've been chatting about at the beginning of every Toolbox Talk. That is, wash your hands regularly with soap or alcohol-based hand sanitizer if you don't have soap and water available. Obviously, soap and water is a lot more effective, but if you do not have that during the day, you can use an alcohol-based hand sanitizer. Then avoid touching your eyes, nose, and mouth with unwashed hands. Avoid close contact with people who are sick. Cover your cough or sneeze with a flexed elbow or a tissue, and then throw the tissue into the bin. Clean and disinfect frequently touched objects and surfaces, which would include your vehicles, your personal protective equipment, your tools, and the things that you are using to work with at work. And then do your part if you can. Get vaccinated. Are you still questioning whether you want to get vaccinated? Is your company telling you that you should be getting vaccinated and you feel that that is against your constitution? Well, what is the law on vaccinations? Well, we are releasing the course today, COVID-19 vaccines. What are they? What is the awareness around them? We take you through 4 parts or 4 sessions explaining to you what is a vaccination, then what types of vaccinations are currently available for you, what are the side effects and what are the benefits. And then also we discuss very important things like, is it mandatory? Can your company force you to get vaccinated? So if you haven't made a decision yet, if you were wondering about it, if you weren't sure what the law said, and perhaps you have a few questions yourself, take a look at that course. We are releasing it this afternoon. So if you are part of this Toolbox Talk and you would like to get in touch with us to make sure that you have that COVID-19 vaccination course available to you, it is a free course. You will receive a certificate at the end stating that you've been on that course and that you know and understand the vaccinations, so that you can make an informed decision whether you want to continue with not being vaccinated or if you would prefer to get vaccinated yourself. Please remember, all of this should be in conjunction with a good communication between yourself and your employer. As an employer, if you're listening, if you want your employees to get vaccinated, perhaps go on this course and see if there's anything there that can assist you in encouraging them or motivating a good reason to get vaccinated. It's not just about, I said so and you must. That is not what the law is saying. Obviously, these Toolbox Talks brought to you by IOPSA. You can get in touch with us there at safety@iopsa.org. If you'd like any information on these Toolbox Talks or the vaccination course, you can get in touch with us on info@ohss.co.za or send us a WhatsApp on 071-875-2070. As always, it is accredited with 1 CPD point through SIOSH, as well as 0.25 CPD points through PRB. Our safety thought for this week is start safe, finish safe. In other words, safety always. We have a lot of slogans out there saying start safe or safety first. Well, we encourage that. It's very important, safety first. But what we also want to say is safety always. Don't just start safe, finish safely as well. So medicals, what are medicals? When do you need to have medicals? And what are the types of medicals you should be getting for your staff? Well, a medical is an examination to assess a person's state of physical health or fitness. That's really what a medical does. Depending on the scope of work or what they are going to perform, this examination assesses whether that person is physically healthy or in a good state of fitness in order to perform that work. Now, medical surveillance is just what a company does as a planned program for these periodic examinations. In other words, medical surveillance is a program that is put in place in order to ensure that medicals are done on employees, perhaps not all employees, it might only be some employees, and that all depends on risk assessments, the scope of work, or what are the elements that they are exposed to. And this is specifically, and for you as plumbers, will include clinical examinations on biological monitoring. Reason for biological is because you're exposed to a lot of biological hazards. Now, the employer is responsible for ensuring that this medical surveillance is performed in the correct manner. And as an employee, you are responsible to go on the medicals if you are sent for one. Now, the information that is contained in a medical is obviously, it's your property. It's personal. However, the employer should know some of the information. Now, why do we say that? You might say, well, it's against the Constitution. It's against the Poppy Act. It's my private information. How can somebody else take that? I have protection against this according to the law. Well, let us take a look at what the law actually says. It is the duty of all employers to ensure their employees are safe and work within a safe environment. So yes, they provide you a working environment that is safe and without risk to your health. And that includes exposure to things like hazardous biological agents, hazardous chemical substances, or any environment that may cause you to become ill. We know and understand this a lot better now when it comes to COVID-19. Your employer will not send you into a place without a mask, without telling you to sanitize your hands or to disinfect the area, just in case there is the potential to exposure to COVID-19. And that is a biological hazard because it creates an illness in a person. Now, any other illness or any other virus or bacteria that's out there in terms of biological, when working with waste pipes, we need to do the same thing. We need to protect ourselves. But how does the employer know if you are being kept safe? Well, that's where a medical will come out. You see, before you started working in that environment, the employer would send you and see if you were physically healthy or fit to perform that work. And if you were fit to perform that work, and throughout the months and years of working in that same environment, you started getting ill, then the medical or the medical surveillance, that program where periodic examinations would occur, would start showing that you are deteriorating, either within your eyesight, your hearing, your breathing, your respiration. All of that could start deteriorating. Now, your medical practitioner, the person who performs this actual medical, might have a look at certain things and say to your employer, there is something that is of concern because the employee has an illness that is related to their work. Now, that's very important. Employees, please be very specific to your medical practitioner or the person taking your medical as to what it is you actually do at work. Not all the information contained in your medical may be openly exposed to your employer. The only time that a medical doctor may advise your employer as to certain restrictions or mitigations for risk or exposure will be when they realize it is an occupational disease. You see, if you have something like HIV/AIDS, that probably is not an occupational disease. And so your employer may not need to know that information, and you can choose whether to divulge that information to your employer. So that is not necessarily the information that they are going to divulge. But those who are working with asbestos or waste, and then you start getting these biological issues or respiratory issues, such as carcinogens that are found in asbestos. Now, you mention that to your doctor, the doctor will immediately speak to your employer and state that it is recommended that you do something more to protect yourself against the asbestos exposure. So you can see that your personal information is still protected. But how can your employer really protect you if he's not sure what is actually going on? That means good communication. So it's understandable that to ensure employees are kept safe, we also need to ensure that they are kept healthy. That is why it's called the Occupational Health and Safety Act. Now, one of the areas in which employers will have to keep employees safe is under your thermal requirements. And this is your environmental regulations for workplaces. If you expose your employees to temperatures below 0 degrees Celsius, you are not allowed to do so unless you are sending your employees for medicals at intervals not exceeding 1 year. In other words, every year, that is the minimum requirement. It may be requested by the medical practitioner that you do it every 6 months, every 3 months, depending on your exposure level or your level of health or fitness that they pick up. Also, where the time-weighted average, your WBGT index, determined over a period of 1 hour, exceeds 30 in the environment in which an employee works. Again, intervals not exceeding 1 year. So if you are working in that specific environment with those thermal requirements Perhaps it's in freezers, perhaps it's in boilers. No matter where you are positioned, if the thermal requirements fall within the environmental regulations for workplaces, Section 2 or Section 4, then you are going to have to ensure that those employees are sent for medicals. But perhaps you're saying, well, as a plumber, I'm not exposed to those thermal requirements. Well, then what about the hazardous biological exposure? You see, an employer, after consulting with the Health and Safety Committee established for your workplace, that is if you have 20 employees or more. If you don't have 20 employees or more, then you will have to discuss this with the employees themselves. You must then ensure that any employee who is at risk of being exposed or exposing others to hazardous biological agents is comprehensively informed and trained on obviously the actual hazardous biological agent itself, on the risk assessment. This is both a practical aspect as well as the theoretical knowledge, and then also the necessity of medical surveillance. So if you're exposed to hazardous biological agents, then you also need to ensure that your employees go for medicals. Now you'll notice this is the necessity of medical surveillance. Now, surveillance is a program to ensure that periodic medicals are done. Again, this is going to be no more than 1 year apart. So every 12 months, that employee should be going for a medical. Now, as plumbers, you are exposed to certain hazardous biological exposures or hazardous biological agents. If your exposure is high, please remember to take a look at your actual risk assessment and determine whether the risk assessment is specifically including your medical surveillance. Now, you might be asking yourself at this point, well, then why must we do medicals for our staff? Maybe you're not exposed to thermal requirements. Maybe you're not exposed to very high exposure of hazardous biological agents. Or remember, it's not only the construction or manufacturing employees that need medicals. In terms of what we call common law in South Africa, which is recognized in the Constitution, employers have a duty to look after the health and safety of employees. Coming back to Section 8 of the Occupational Health and Safety Act. So even though a salesperson, for example, is not exposed to the same risks as perhaps someone cleaning the windows of a skyscraper, some risks still exist. Should this person be unfit physically or psychologically to drive long hours, but is still required to do so, the employer could be liable should an accident occur. So let's look at that again. In terms of common law, this is recognized under the Constitution. Should a person be unfit, either physically or psychologically, to drive long hours, but is still required to do so, the employer could be liable should an accident occur. And this type of liability is legal liabilities that we are trained in as employers, as managers, as supervisors. What does the law require from you in terms of being in a managerial or supervision perspective? Now, you could be held liable for that person's injuries. The cost of a medical is far less than an expensive lawsuit and a good way of protecting yourself from any legal liability. A medical nowadays ranges between 300 to 500 Rand for most of the medicals that we send our clients on. Now, we don't personally do medicals. We work with others out in the industry, either in Cape Town, Durban, or Johannesburg, and they will then do the medicals for you. But the cost of that medical far, far outweighs the exposure that you will have if an incident or accident occurs and you are held liable, indirectly liable. Now, this type of vicarious liability in terms of common law or just normal legislature says that an employer might be vicariously liable or liable without fault. What that basically means is it was not your fault that the employee was injured, but you are still liable for the damage or the accident that occurred. And this could come with obviously certain restrictions, certain fines, and any of that constitutes bad. It's not good for you as a company, not good for you as an employer, and really not upholding what Section 8 of the law says, looking after our employees' health and safety. Now, when it comes to medical surveillance, It's a periodic examination of an employee. And this means that sometimes when an employee leaves our environment, we need to protect ourselves to ensure that a person is not sick when they leave our service. And this is what we call an exit medical. But an exit medical is not only for departing employees, not only for an employee who leaves work. Beside the medicals required by law, for instance, in these dangerous workplaces, such as construction sites, workshops, or hazardous biological agents, as we saw, there are 3 types of occupational medicals that should actually be done within a medical surveillance program. This is a pre-employment. So before you start working for me, I want to see that you are healthy and fit. Then my annual ones, which is the minimum requirement in terms of the law, and then an exit medical when you leave that dangerous environment. Now, legally, a person who moves from a non-hazardous environment to a hazardous environment would need to undergo a pre-employment medical. You see, if you were working in the same company for 10 years and you've climbed the corporate ladder and you went from washing vehicles to cleaning tools to being a plumber to perhaps being a master plumber within the company, and now you are starting to delve into a different part of plumbing. Perhaps you're going into a little bit more of an engineering side where you are exposed to much more hazardous environments such as trenches or confined spaces, working at heights. All of that now is not part of your original employment, was it? You see, you've now changed from a non-hazardous environment to a hazardous environment. You would need a pre-employment medical. Now, that would be the same with an employee moving from a hazardous environment to a non-hazardous environment. See, if you were taken off working in trenches and working with excavations to now become a manager or a managing salesperson, or perhaps even a director of a company, where you're not going to physically do that work anymore, but you are still part of the original company, you would then require an exit medical to prove that the work that you were doing, even though you're not leaving the company, but you are leaving that hazardous environment, you would then require an exit medical. And that again comes down to your occupational health and safety, hazardous chemical substance regulations. It is written in the law. So what are we talking about when it comes to medicals? Well, medicals and liabilities go hand in hand. Medicals keep both employers and employees safe from a liability perspective and an occupational health and safety perspective. Without medicals, it would be very, very difficult to disprove a claim from an employee. See, how would you prove that they were not injured or became ill because of the work that you do? Employers can be found guilty and sentenced for anything that contravenes the Occupational Health and Safety Act, unless they can prove that they took all reasonable steps to prevent it. Now, this is very interesting because one of the strengths and weaknesses of the Occupational Health and Safety Act, for one, the Occupational Health and Safety Act is a written piece of legislation. In terms of the law, it's a piece of legislation that what we would call is something that is codified. In other words, it is a written standard of legislation in order for us to help understand how we organize behavior, either the behavior of an employer or a behavior of an employee. And this then moves us to apply the law in different situations. But the strength of that is that it is written down. The weakness, though, is that it is not 100% specific. It doesn't tell you as a plumber that you must get a medical. It tells us to be reasonably practical. In other words, it means that we need to interpret the piece of legislation for ourselves as an employer. How far are you going to go in order to prevent your employees from being injured? How far will you go to prevent your employees from becoming ill? Well, these reasonable steps are, in terms of liability, your responsibility. In other words, what do you need to do? Consulting with an occupational health practitioner is the best way to ensure you are up to date in the ever-changing landscape of occupational health and safety regulations. Section 42 of the OSH Act states that the minister may direct any regulations over and above the OSH Act. What are the regulations that we are speaking about? Well, one of them could be the noise-induced hearing loss regulations. It could be the construction regulations. It could be the hazardous chemical substance regulations, hazardous biological agents regulations. You see, over and above the OSH Act, they might be a little bit more specific. And these regulations will say specifically to construction, you must have a medical. Now, that's obviously up for interpretation, isn't it? Because if you're not working in construction, you might say, the OSH Act doesn't specifically tell me to go for a medical. But if you are exposing your employees to hazardous biological agents, thermal requirements, or as we see here, noise-induced hearing loss environments or noisy environments, these are considered hazardous. And medical surveillance, which is used to detect negative effects, in other words, the deterioration of fitness or health, is obviously required by law in instances where employees are exposed to these dangerous environments. And that would also include things like lead, asbestos, certain chemicals, as well as what we've discussed, biological agents. Noisy environments is no different. These medicals must be done from time to time. And again, it states within a minimum, an annual medical should be done. If you want information on that, the noise-induced hearing loss regulations will outline that for you. And then we come down to where a lot of our plumbers actually work in, the construction arena. Now, construction regulations, and this is very specific. So as I mentioned earlier, with the codified law in terms of the Occupational Health and Safety Act, this is a written piece of legislation that helps us to understand a broad aspect of legislation. We now take a more specific piece of legislation, and that is in terms of construction. Now, if you are on a construction site, or if you are performing any works that falls within the definition of construction. In other words, you might be at a private home doing demolishing or changing to a structure that could fall under the definition of construction. And thus the regulations would apply to you, maybe not in whole, but definitely in part. And if you are a contractor or a principal contractor, as it shows at section 7, specifically point 8, it says a contractor must insure. Now, this is not reasonably practical. Remember, this is not a piece of codified law. This is a piece of legislation that is directly specific. So this is drafted by the country in order to state that this is what will happen. Must means you have to do this. Ensure that all his or her employees have a valid medical certificate of fitness specific to the construction work to be performed and issued by an occupational health practitioner in the form of an Annexure 3. So an Annexure 3 medical is what is required for the construction regulations. Now, if you have any more questions on what medicals do you need, what sort of exposure you have, please get in touch with us. We might not be able to have all the answers specifically to your environment, but a good idea is to speak to your staff, speak to your employer, maybe get a occupational health practitioner involved and discuss with them what is the best way forward. Again, medicals are relatively cheap. In view of what incidents and accidents cost us, they are very cheap. If somebody falls and gets injured, you're talking about thousands of hundreds of thousands of rands compared to a few hundred for a medical. So yes, we are not saying that it's cheap. If you have 10 employees and it's 300 Rand times 10, which is 3,000 Rand, that is a lot of money. If you have 20 employees, it's 6,000, or depending on where you're going for your medicals, how often you need to go for them, it can become quite expensive. But that type of cost, first of all, cannot improve an employee's health. It cannot keep them safe. That cost is what you will spend on incidents and accidents if you are not protecting your employees. So again, the safety thought for this week, don't just start safe, finish safe as well. In other words, safety always. Now, coming up for the last week in November is looking at part 2 of Can I Do My Own Safety? This is your own safety files, perhaps your own risk assessments, things like that. And the answer is yes, you can do it. So what are the steps that you need to follow? Perhaps you need help with it in the beginning, some sort of mentorship program in order to assist your company in getting to the point where you are self-sufficient when it comes to health and safety. If you haven't done so yet, that COVID Compliance Officers course is still available to you. As we mentioned earlier, we are also releasing the COVID-19 vaccine awareness course this afternoon. So if you want any information on that, please get in touch with us. Please don't forget, on Mondays at 8 a.m. is the Man in the Van podcast. That is education through a conversation, available on those various platforms. And finally, to end off, just those tips again to continually prevent COVID-19. And after those 5, if you get to point 6 and you say, I'm not getting vaccinated, well, listen to that course that's coming up at the end of today. So it should be released around about 4 or 5 o'clock this afternoon. Maybe go through it, take a look at the information. Again, you will get a certificate to say that you've gone on it. It doesn't mean that you have to get vaccinated, but rather make an informed decision. A very big thank you to all of our attendees this morning and those who are constantly keeping in touch with us to get the best information out there.